Hello, I'm Dr. Chunyoung Park from Deep Plane Plastic Surgery, a surgeon who truly loves facelift surgery. Many people considering a facelift are concerned not only about a sagging skin, but also about bulge beneath the chin, a blurred jawline, and a neck that appears shorter because of their changes. This is especially common in people with a naturally small lower jaw or short under chin structure. Even with the same degree of aging, these individuals often develop a heavier looking jawline and less defined neck contour compared to others. The patient we are discussing today had more than simple skin laxity. She was 62 years old, a woman who primarily concerned were bulge under the chin, a loss of jawline definition, and a neck that appeared short and heavy. In cases like this, simply pulling the skin tighter is usually not enough. It's important to understand what structures are creating the bulge beneath the chin, how the face and neck have descended over time, and which lifting technique will produce the most natural improvement. In today's video, we will review her before and after photos and explain why a submental lift was necessary, why it is combined with a deep plane facelift, and how her jawline and under chin contour changed 3 months after surgery. Her journey to our clinic was a little unique. Her daughter had previously undergone facelift surgery at Deep Plane Plastic Surgery. As her caregiver, the patients accompanied her daughter throughout the consultation process, surgery, recovery, and follow-up visits, allowing her to see the entire experience. Her daughter had originally visited us because she developed facial sagging after a facial contouring surgery performed elsewhere. This is actually one of the most common reasons younger patients seek facelift surgery, and we will discuss that topic in a greater detail in a future video. Having personally witnessed her daughter's surgical journey and recovery, the patient decided to undergo facelift surgery herself after a consultation. Fortunately, both mother and daughter were very satisfied with their outcomes, which is something that I truly appreciated. Now let's take a closer look at the patient's facial anatomy and the surgical plan. The patient had a relatively small lower jaw with a mid-mandibular hypoplasia. In addition, her hyoid bone, the small bone located in upper neck, was positioned lower than the average, resulting in a very short distance between the cheek and the neck. When the lower jaw is small, there is a less bony support for facial soft tissues. As a result, signs of such as jaws, sagging beneath the chin, and the loss of jawline definition tend to develop earlier than individuals with a larger or stronger jaw. For this reason, facelift surgery often produces especially dramatic improvements in patients with a small lower jaw because restoring the jawline and neck contour creates a much more noticeable change. This patient had a significant bulge beneath the chin. Our examination showed that the under chin bulge was not caused by the skin alone. It resulted from a combination of deep fat beneath the platysma muscle, enlarged muscles under the chin, and enlarged lymphatic tissue. Because of these deeper structures were contributing to the bulge, an additional submental incision was necessary to achieve the best possible contours. So, to further improvement for facial profile, we also planned a chin implant to compensate her more naturally small chin and create a better projection and depth beneath the jawline. Since she had no significant medical conditions, the surgery was performed under the IV sedation and lasted approximately maybe 4.5 hours. The procedure was based on the deep plane facelift technique. Through the under chin incision, the platysma muscle was carefully elevated and enlarged anterior digastric muscles and subplatysmal fat and excessive lymphatic tissues were reduced, and the platysma muscle was then repaired and tightened. It is important to understand that tightened platysma muscle from beneath the chin alone does not effectively lift the neck. For this technique to work properly, the smooth layer of the face must be also elevated. Together, these structures function like a hammock, lifting the smooth raise the entire support system more upward. Simply stretch the platysmal muscle throughout the under the chin incision without lifting the smash is like tightening a hammock without actually lifting it. In our experience, this approach cannot relatively produce meaningful or long-lasting improvements. The following photographs compare the patient's appearance before surgery and 3 months afterward. Before the surgery, there is a significant bulge beneath the chin, making the transition from the chin to neck appear a little bit short, heavily and poorly defined. At 3 months after surgery, the bulky tissue beneath the chin has been significantly reduced, as the excess volume under the chin was removed and the jawline beneath much sharper and more naturally defined. Although 3 months is still relatively earlier in the healing process, with some residual swelling and firmness remaining, the improvement is already clearly visible. Compared with her pre-op appearance, both the under chin contour and neckline look considerably lighter, cleaner, and a little bit better defined. Today, we reviewed facelift cases of the woman in her 60s who presented with significantly sagging beneath the chin. If you have any questions about today's case of facelift in general, please leave a comment or contact our clinic. We will happily to answer them in detail. I'm Dr. Junyoung Park from Deep Plane Plastic Surgery, a surgeon who truly loves facelift surgery. Thank you for watching.